Pastor, the next question that we have is, what are the different types of dementia?
Right. So dementia has common types, uncommon types, and rare types. And most of our lives, my clinical work, I spend looking after the common subtypes of dementia. The commonest subtype is Alzheimer's disease. It's almost more than 60% of people will have Alzheimer's disease, but it depends on where and what kind of population we are dealing with. In people who have high prevalence of diabetes or hypertension, it can be the second type, which is the vascular or the multi-infarct dementia. But then if you combine both of them, there is a mixed type dementia as well, which has features of Alzheimer's disease, but also had diabetes or hypertension or previous stroke or something like this. So those are three commonest types that I see in my practice. I also work, because I work with the dementia patients, I do see some patients which are called Lewy body dementia. Now, Lewy body dementia is usually diagnosed after somebody has died on a biopsy, but we have certain typical features of Lewy body disease dementia because these are patients who react badly to normal dementia medication. And that is usually the key to finding out what is Lewy body dementia. So somebody who reacts badly to normal, usual, typical medication used in dementia patients, then we suspect Lewy body dementia. This last type is called frontotemporal type of dementia. So if I go to this picture again, which is the third figure, which I'm pointing out here. This is the front part of the brain. And if you do a scan of these patients, the front part of the brain has got loss of volume more than other parts of the brain. And like I said, it controls your personality, it controls your thinking process. And these are patients who present with new personality problems. And most typically, the spouse, wife or husband says, this is not the person I married. This is not the person I used to live with. And friends start saying that this person is somebody else. He is not behaving like he used to last year. And he is no longer my friend anymore. And it is a very heartbreaking condition that frontotemporal type, and they can present in various ways. The behavior can be as simple as they start gambling, or they start going out, or they become they lose the ability to be private. So they don't. How can I put it? They become less private person, and they don't mind taking their clothes off in public and things like that. So it is a very heartbreaking condition. There are uncommon types of dementia, and these are those which we have started seeing now. So Down syndrome is a genetic disorder with children with specific eyes, and they have specific features. And these patients are now living more than 60-year-olds, and we are seeing that around the age of 60, they start having features of dementia. So it's called Down syndrome-related dementia. There is another condition called normal pressure hydrocephalus, in which the brain fluid pressure goes up and it starts destroying the brain cells. And it's very easily treatable. We can now put a shunt in the part of a brain which is drained into the abdomen, and you are treated. So it is it is very important to recognize that, because it is a treatable form of dementia. Another one is Parkinson's disease-related dementia. And as Parkinson's patients progress, and we are able to keep them functional for longer periods now with the advances in medication, we have started seeing this, that the same pattern is affecting the movement part of the brain, it is now affecting other parts of the brain. It's the same disease which is spreading now. Corticobasal degeneration is a similar disease which affects movement, but it is affecting the base of the brain. And then there is alcohol-related dementia. So I would be hopeful that there is not much of that in Pakistan, but I know people drink in Pakistan as well. There are rare forms of disease which are dementia. So different types of Creutzfeldt-Jakob disease, which used to be called mad cow's disease, that presents as dementia. There is an inherited disorder called Huntington's disease, which is usually transmitted in males of the family, and that is a very progressive brain disease, but that happens quite early in life, 20s to 30s. Then there is the chronic traumatic encephalopathy, and the most famous person who had that is this guy. This is Muhammad Ali, and this was related to his boxing, and his brain got so many injuries that he had features of dementia developed when he was old. HIV is a problem that is developing, is present in Pakistan as well, and HIV-associated dementia is something also that affects earlier in life. So these are different types of dementia.
All right, thank you, sir. That was quite a lot of information, and you talked about the common forms, the uncommon forms of dementia, and thank you for sharing this valuable information. Because there are certain types of dementia which I think are commonly found, but there is again a category of those kinds of dementia too, which are now being revealed, and as research is introducing those forms of dementia to us, I think that is another area of medicine that we're about to explore. And I think this is great that you just talked about some of the most common as well as some of the most uncommon forms of dementia. So this is great information.